Thank you for introductions, dear ladies and gentlemen. First of all, I would like to say thank you for the invitation here to come to this great congress. I really enjoy it. And I'm very happy that now I can share the experiences from St. Pölten, which we did over the last years with early fitting. And I would like to expand a little bit, so I would also speak about early activation. What are the key points of successful implantation? This is what we heard the last days often. So we know that the diagnostic is very important, and this we are doing with the newborn hearing screening. After that, a smooth surgery with minimal invasive access is important, and then we can go on with very early or early activation and also with the early rehabilitation. So what are the preconditions to start the rehab immediately? We have to have well-prepared patients, also well-prepared parents, so it's very important that you also inform them before surgery. Then it's possible to do this smooth surgery with the minimal invasive access. Because of this, you have the short time of healing period, and of course, we need the very early activation. So looking back, what are the changes in strategies over the last years? So in former times in our hospital, the general recommendation was that the speech processor was fitted 4 weeks after surgery. And since 2013, we switched this, that we did the first activation routinely the second week after the surgery, and this is doing since that time. And this is based on a publication we did in the year 2015, and here we could show that this early activation 2 weeks after surgery is possible because there was acceptance of the patients. We showed that there was no postoperative changes in the telemetry and the impedances, and of course we could show that the real important point and the predictor for the early activation is not the impedance measurements, it's the shorter time of the wound healing after the minimal invasive access. Based on this study, we also wanted to know if very early activation is also possible, because we also had a lot of children which we are doing in our clinic, and they are from far away, and so we try to do the activation at the first postoperative day. Also here we did this minimal invasive access. We knew that it is useful, and we also measured the impedances intraoperative and the first postoperative day. And also in this study we could show we analyzed the first 27 years. It were children, 5 bilateral patients, age range were between 8 months and 12 years, and we also measured the impedances the first postoperative day. There were no significant difference. We also had no problems with the wound healing, so also no swelling, and also no problems with the magnet fixation, and we also did it, we heard before, with the band and fixed it on the clothes, so we just had the magnet over the implant. So also since that experience we know that the very early activation is possible. And this brought us to the thing that we also try to do now a very early rehab after the early or very early activation. And so the idea was that the patients are staying at our clinic, they are hospitalized for 1 week, and we started this with a pilot study since February 2024. And we know that not only the surgery is important, not only the rehabilitation and the activation is important, we are knowing that we have to work together in the team. So to work hand in hand with the surgical team, the nurses, also the audiologists, the speech therapists, and as you know, we also have a music therapist at our clinic, and the technicians from the companies are also coming to the clinic, and we are working hand in hand. And so we started after the surgery with the medical care, so we checked if the wound healing is okay. Then we do the typical audiological check, and then we also start with the informations, with the speech therapy and the music therapy. These are our including criteria because we were thinking who patients should we pick out. And so we included all the patients who were bilateral severe hearing loss. They should be motivated, that's what I said. So you have to inform the patients before so that they know what's going on the next week. They should have the will to stay in the hospital for 1 week, and they should be in a general good condition, and they should have the willing for an intensive rehabilitation program for 1 week. This is our rehab program after before we started with this pilot study. So we did the fitting 2 weeks after surgery, and then we tested them 1 week, 1 month, 6 months, and 3 months later on, and then going on intermediate with 1 year controls. And in the meantime, they also had speech therapists and also music therapy. But this now is our new concept. So as I told you, they stay for 1 week at our clinic. We do the surgery the day before when they came to our hospital. They get all the information regarding to fitting, regarding to therapy. And the first day after surgery, we do the wound control if everything is okay. And then we start already with, and this is interesting, with music therapy and with speech therapy. And this they are doing 2 or 3 times a day. And at the end of the week, so after 5 days training, we also check this with the Puton audiogram and the speech audiogram. So since that time, because I told you we picked out these bilateral severe hearing loss patients with the willing to do this rehab program. So we included now 12 patients. The age were between 30 and 78 years, and they had this bilateral severe hearing loss, and the duration of their deafness was in a mean 15 years. This is the Puton audiogram preoperative, so you see the contralateral side is also very bad, so this was including the criteria. And now coming to the result of the Puton audiogram, so this is the result 5 days after the therapy. So they have a very good hearing threshold after 1 week training. And I think this is the interesting slide here from my presentation, because we check the speech audiogram 5 days after staying at the clinic. And what you see, they came at 65 dB from 1% up to 90% speech understanding. And at 80 dB, they came from preoperative 6% up to 37%. 0.8 speech understanding. And these, I think, are really, really good results. And from the personal experience, we see that it's very hard for the patients, the training period. They are not so motivated the second day because they hear that they recognize that they don't hear, they don't understand. But after the 3rd day of training, it's going up, and they really come to speech understanding nearly 40% after 1 week training. So what can we conclude after our first experiences? As I said, it is very heavy for the patients. You need to have patients with a high motivation, but they see their very, very steep learning curve. They like the regular support, and they like it that they get supported for 1 week after the surgery. Especially we observe this in the elderly patient, because sometimes they are alone at home and they do not know how to handle the equipment in the first weeks after the fitting, and so they have really good support after this in this week. And what they liked is the check-up after the first week. So when they see the number that they have nearly 40% speech understanding in monosyllables, so they are happy and we are happy as well. What can we discuss after these experiences? We want to go on with questionnaires, of course, to evaluate the quality of life, especially with this very early activation and rehabilitation. We also separated the music therapy session, because we think this is a very important part to get these good results. And we are also discussing if we should do the surgery when they have the surgery simultaneous also in a one-step surgery bilateral sites. And so with this, I would like to close my presentation. And our clear recommendation is as well to start early activation, to start early rehabilitation. And so the speech understanding, and this is what we could show, can start earlier. And this is a very good support for the patient, and especially for the elderly ones. With this, I would like to close, say thank you for your attention, and I would like you to invite you to our next congresses in the year 2025 in Vienna. Thank you.
Thank you, Astrid, for sharing your experience with us. I think we've got time for one question from the audience.
No question.
No question from the audience? Maybe I have a very small question.
Dr. Baumann, I think so.
Is
yeah.
there one?
Yeah.
Oh, sorry,
Yeah.
Uman, yes, there you are.
Several points, yeah. They repeat it twice or three times, yeah. Mm-hmm.